let's talk about acne. Now, when you're going to treat acne, are we going to microneedle active acne? No. Why? Because you're now going to be, potentiating this spread of infection, right? So when we're saying acne treatments, we're more concerned with acne-prone skin rather than a patient who's coming in with a crisis of acne. So if the patient is coming in with a crisis of acne, we would first need to resolve the crisis, and then we can progress to treating the acne-prone skin, where we would be able to decrease the probability of that person getting more and more infections or inflammation. Now, can I microneedle a patient who I just had on tretinoin? No. Remember, you have to observe, what these drugs are saying. So you have to make sure you do a washout, okay? Then we have the acne scar. Why is it that the acne-prone patient and the acne scar patient, we treat at different depths? Let's look on it. This is the skin, epidermis, dermis. The glands, they tend to reside like here. And when you have acne, you have inflammation of the gland because it's blocked. And that inflammation, let's use our head. This is the gland. If we have inflammation of the gland, the inflammation is not going to be just, that lining of the gland. It's actually going to engulf tissue around it. Let's think about inflammation. You get a cut, it's not exactly on, where you've been injured. It's a little bit wider, okay? So that means when you have the inflammation, all of this area will be affected. What is the scar? The scar is actually death and destruction of this gland. So all of this tissue has now died, it's no longer there, and you have a hole, okay? So that means that my needles need to go deeper if I want to touch the bottom of the hole. Making sense? So that's why you're going to notice that there's a difference in depth of penetration.